Across the U.S. every year, millions of people are forced out of their homes. While these evictions are usually thought of in economic terms, a problem of housing supply and income, a growing body of research is showing that evictions also take an enormous toll on people's health. William Brangham recently traveled to Richmond, Virginia, a city with the second highest eviction rate in the nation.
For Sergeant Larry Trotter and Deputy Juan Cervellon of the Richmond Sheriff's Office,
Hello, Sheriff's Office.
this is what a typical morning looks like.
The average for us would be anywhere from 40 to 50 evictions a day.
Go ahead, put your shoes on. I'm gonna need your dog be taken out as well.
They crisscross the city serving evictions.
I get there and people want to curse me out, but I understand that. So you got to give them that chance to vent, because they're losing their home.
It's a scene that unfolds in Richmond more often than almost anywhere else in the country. And those evictions can stay on a renter's record for at least a decade.
In the city of Richmond, there are roughly 18,000 eviction lawsuits filed every year.
Marty Wegbright is an attorney at the Central Virginia Legal Aid Society, a nonprofit that represents and advocates for low-income tenants. He says Richmond's eviction rate spiked for many reasons.
We have a shortage of affordable housing. We have a poverty rate of 25% in the city. We have gentrification. We have a history of racial segregation, state-sponsored racial segregation. So it's all of those factors combined.
Virginia has long been considered a friendly state for landlords, with a host of laws that make it cheap, quick, and relatively easy to evict tenants.
The filing fee to file an eviction lawsuit in Virginia is $58. By comparison, in Alabama, it's $250.
But that ease also extracts a real toll on the people being evicted. Letitia Lee is a single mother who lives in public housing in Richmond.
When you get that knock on the door, what is that like?
It's scary. Like, your heart will drop and you don't know what to do. And like in my case and a lot of other people's cases, they don't have nowhere else to go. Like, where they're at is where they depend on to lay their head every day.
Lee works 7 days a week as a home health aide, feeding, bathing, and caring for elderly clients. But even so, she says she's constantly afraid she won't have enough to pay her rent.
They'll put it on your door and just walk away, and sometimes...
That's the notification on the door that says you're being evicted. Get out.
They'll give you a certain, like, they'll let you know, like, if you still haven't paid this by this day, then you have to be gone within a matter of this time, and the sheriff will be there. And it happened to me like 3 or 4 times.
Lee says she's always been able to come up with enough money to avoid eviction, but she says her family is still living right on the edge.
Okay, take a big breath. Go.
They had to recently move for a more pressing issue. Her last place made her son Nishon's asthma much worse.
He do the inhalers, he do treatments, he do the Flonase, and then he has actual medicine he takes.
It's a lot for a 4-year-old.
Yeah, but he done got used to it. He know how to do it all by himself.
She says their old apartment had rats, and the walls and air vents were covered in mold.
My doctors even said we can't be in the apartment, we gotta leave because it's a health hazard.
The majority of low-income renting families in the U.S. spend over 50% of their income on housing. That's according to Princeton's Eviction Lab. And according to Catherine Howell and Ben Teresa of Virginia Commonwealth University, that often forces families to accept substandard housing after they've been evicted.
This is a problem that is disproportionately felt by Black people, and in particular, Black women.
The pair has spent the last few years mapping exactly where evictions are happening in Richmond.
When you look at the preponderance of unsafe and unfit structures, you see a lot of overlap in the neighborhoods where we have high eviction rates. We also have high numbers of code violations in these buildings.
It really is where you live that actually may be the most important part of your health. Stay still.
Dr. Megan Sandel is a pediatrician at Boston Medical Center who has written extensively on the links between housing and health. She led a team of researchers who interviewed more than 20,000 families in 5 cities.
We found that those families that were homeless and the families that were behind on rent had very similar adverse health outcomes, which signaled to us that homelessness is bad, but behind on rent is just as bad for kids' health and their parents.
A 2018 report out of Seattle found that mental health was the most commonly cited complaint of those facing eviction, including varying levels of depression, anxiety, and insomnia. And even for families not facing eviction, housing instability can be just as detrimental.
I have to continue to make believe that everything's okay.
Back in Richmond, Carmen Candelario has been living paycheck to paycheck for years. She now works 2 jobs, a translator for a local hospital and a hotel banquet server.
And my pictures had the dots everywhere.
The mold growing on your pictures.
Yeah.
She and her daughter have moved 4 times in the last 8 years because she says the homes were all unsafe to live in. A little over a year ago, she moved into this rent-subsidized apartment, but almost immediately, her 12-year-old daughter, Amida, started having health problems.
She had a lot of breathing problems. She had a lot of hives. She had a lot of fever, shortness, out of breath, which I thought was due cause to asthma, but we were allergic to the apartment.
Candelario complained about what she said was frequent mold and dampness in the apartment, but she claims the landlord ignored her. She believes it's still making her daughter sick and says it's caused a new problem for her.
So last year she missed out 27 days of school. Within that 27 times of her being absent, I also called out 27 times.
So that you could be home with her when
and
she's
taking
sick.
her to her doctor's appointments and picking her up from school. I'm on my last lifeline because if I continue to call out due to health issues, I am fired.
Last fall, Richmond's mayor, LeVar Stoney, unveiled a pilot program to help about 500 families avoid eviction over the next year. The program set aside nearly $500,000 to help tenants pay overdue rent.
Housing is foundational. It's the vaccine to poverty. And so if you are able to have a safe, quality roof over your head, and then that gives you the ability to put food on the table, that's going to help you rise up that economic ladder.
Meanwhile, Letitia Lee says she's tired of having to live in places that she says make her son sick. But she can't afford anything better right now.
Does he understand any of the stuff that's going on?
I don't think he does. He just know he tired of being sick. That's all he could tell me is, Mommy,
Really?
I don't want to be sick no more.
For the PBS NewsHour, I'm William Brangham in Richmond, Virginia.